Let's talk about routes of administration or ways of getting a drug into the body. And in our case, we're most interested in getting the drug to the brain. Well, how do we get drugs to the brain? Through the blood. So these routes of administrations vary in how they get the drug into the blood. And depending on how you do that, you can affect the variables we talked about here. Depending on how you take a drug, it can get to your brain faster or slower. You can get more or less of it into the blood at one moment, and it can be excreted faster or slower out of the body. And these variables matter, right? Now, the first one, this is just specific to the effects of the drug. Okay, the extent to which the chemical affects the reward system. But these can be very much affected by the route of administration. There's no faster way to get drug into the blood than to put it right in there. So this is intravenous or IV injection. Now, let's think about this. If you're going to take X amount of drug, there's no faster way to get that drug into the blood than to inject it with a needle right in there. And how long does it take to inject the entire dose into the vein? 2, 3 seconds. So if we looked at the blood concentration of the drug, you go from zero to all of it in an instant, and then it's a drop. There's no faster way. And this makes IV use what I think of as end stage drug use. Often, if you're to the point where you're using intravenous drugs, you're likely going to die from the drug use. By the way, how do drugs kill us? How do drugs kill? Overdose. What else? Infectious disease. What else? Maybe malnutrition. Suicide. Violence. Buying drugs, selling drugs, being robbed of your drugs, these kinds of things. This might not be an exhaustive list, but you see, there are many ways that drugs kill. It's not, most people just think of OD, but these are all very important factors. And why don't we put another one here? Exposure. This is with homeless drug addicts, particularly uh, exposure to harsh weather and environmental factors. Now, while in drug addiction, IV is, like I said, end stage, in medicine, it's an absolute lifesaver. That's why, if you're ever hospitalized, one of the first things they do is put an IV line right into you. Because if you become acutely ill, let's say you start having a seizure, they're not going to be trying to throw a pill into your mouth, trying to get you to swallow it if you're in that state. You need medicine now, into the brain now. And there's no faster way than IV. Great. Now, IP, intraperitoneal. The peritoneum is your abdominal space. Your abdominal space. Now, I only know of one use of IP for humans. That's if you're suspected of rabies. Like if a stray dog attacks you and they don't find a dog to make sure it doesn't have rabies, they just might recommend this. If you were bitten by a coyote and they determine it had rabies, you're going to get a series of injections into your peritoneum. So this is side view, fat, six pack, diaphragm. The needle goes through all of these, and the drug is injected into your abdominal space, where the drug is absorbed by the liver and small intestines, and there you go. This is most often, although not exclusively, used in research animals. Most often used in research animals. Just technically easier than other methods. Okay, intramuscular is injecting the drug right into a muscle. Muscle gets lots of blood flow and then venous drainage. And as the blood goes into the muscle and then back out, it'll take some of the drug with it. This is used a lot in doctors' offices for vaccines, also for just general meds, like if you need a, like I remember once I had a severe migraine, I went in and they gave me a pain injection in my butt. I was gonna say bottom and butt, and I couldn't decide, so I said bot. My bottom, and it works. I've also heard people get antibacterial shots into their gluteus maximus. Of course, the other common area that we do this is your deltoid, right? Your shoulder. Subcutaneous is injection of a drug right below the skin. This is how insulin is taken. And I hope you don't have to take insulin. Oral administration is swallowing something, a pill or a liquid. This goes through the GI tract, gastrointestinal tract. This is the most commonly used and the slowest mechanism, but it's so convenient because the vast majority of medicine needs are non-urgent. You don't need to go to a hospital, you don't need an IV or need a shot. You just need to take a pill. And you don't need the pill to work usually. Right now, it's okay if it takes 30 to 60 minutes for this mechanism to take action. The convenience is tremendous. Sublingual is referring to placing a drug under the tongue, but really the entire mouth area can absorb not math. The mouth area can absorb drugs. This is how I quit smoking. Cigarettes, that is. Nicotine gum. This substance is absorbed through your cheek and under your tongue and gets into your bloodstream pretty darn quickly. Pretty quickly. I know there are drugs for seizures that can be given sublingually. I know there are drugs for chest pain that can be given sublingually. Now, intrarectal is what it sounds like, administering a substance right into the rectum. Now, why would you want to do this? A number of reasons. One, if you can't swallow, vomiting, too much. So we give you a pill, you're going to vomit it out. You can't swallow. In babies, Or if you want to deliver drug to the GI directly. Now, when would you want to do this? Well, in cases where systemic administration, which is what you get if you take a pill orally, might not be optimal. Steroids are a good example. Corticosteroids are powerful anti-inflammatories. Powerful. But they're also very bad for you. Taking these systemically is destructive to our bodies. So when you can, you want to try to deliver these kinds of drugs directly to the area of injury, to the area of concern. And if you have ulcerative colitis or Crohn's or inflammatory bowel disease, this might be an option for you. Intrarectal is also unfortunately used for alcohol. Usually in young males, they will insert a tube into their rectum and put beer right in there. Now, the reason they do that is you get extremely intoxicated because the absorption intrarectally is much more efficient than orally. When you take it orally, your body begins destroying it right as it enters the stomach. But if you bypass that route and go the other way around, you get a lot more of the chemical in, which leads to lots of cases of alcohol poisoning and some terrible instances of actual death. Inhalation is smoking. This is smoke. Or huffing fumes. Or if you have asthma, you might have a inhaler. Psst. It sprays out aerosolized medicine that goes to your lungs and helps you. Now, inhalation is extremely fast. IV went from zero to complete in like a few seconds. Now, smoking works like this. The slope is equally steep, but smoking usually goes in a stepwise fashion. Because while you can plunge the entire syringe into your vein in 1 second, in 3 seconds, imagine smoking a marijuana cigarette. You take a puff, you rise, and then you take a break and take another puff, and so on. So while each rise is equally steep to IV, it is nowhere near the blood concentration as IV. This mechanism is also useful with respect to steroids and other drugs that you want to deliver right to the lungs. If you have asthma, your bronchioles are twitchy and they spasm and they tighten up. We could give you steroids to reduce inflammation orally, but that's going to go everywhere and be damaging. Or we can give you steroids as an inhaler. and you puff the steroid in, and it works just in the zone that you're interested in treating. Also, these aren't just steroids. This is also albuterol, just general drug that dilates your bronchial tubes. Topical is right through the skin. Not much more to say about that, but you can absorb lots of substances right through the skin. Intranasal, snorting. This is where you take a drug, um, and you get it up into the sinus cavities. Now, your sinus cavities are coated in a mucous membrane. Soft, wet tissue, just like the tissue in your mouth and in other sensitive parts of our body. So you take the drug and you send it there and you coat the mucous membranes. But the mucous membranes get lots of blood supply. That's why they're moist and plump. And as the blood leaves, again, you take that drug into the blood and it's delivered into the circulatory system and then eventually into the brain. This is mostly a mechanism of abuse, but if you have chronic allergies, you might take, I think it's called Nasacort, and you spray it, and it treats your sinuses and your uh, nasal passages and calms them down. All right, these last two methods are methods just used for animal research because they're extremely invasive. So all of the methods up there get the drug to the blood, and then the blood takes it to the brain and is important to the entire brain at the same time. But what if you're interested in studying the effects of a drug in a particular area of the brain? Well, you need to do intracerebral administration, where you can deliver the drug right into the brain. Highly invasive. It requires surgery because, right, we have to remove the skull to gain access, and plus there's going to be damage all along the path that the needle goes. So this is most specific. A little less specific, but technically easier, is intracerebroventricular. The ventricles are these liquid-filled spaces in our brain, and the lining of the ventricles can absorb drugs. So if you put the needle inside the ventricle and put the drug in there, it's a little less specific than intracerebral, but it's technically a lot easier. Now, bringing this all together, here's cocaine taken 4 different ways. Intravenous, and you see what I was talking about. You get all of the drug in the system immediately, and then you begin to crash. What about smoking? You see what I was referring to. The slope is just as steep because it's that orange line. It's superimposed, supraimposed under the black line. Now, oral, no one takes cocaine orally, but in studies we do it. But if you were to put it in a pill and swallow it, this is what you would get. I completely messed that up. It's okay. Of course, this is oral. And then intranasal goes like that. So you see, this is cocaine taken 4 different ways with 4 very different pharmacokinetics, pharmacodynamics.